Good evening. Today we will learn about ascorbic acid, or which is vitamin C. Active form of ascorbic acid is L-ascorbic acid. It is L-ascorbic acid. So in this topic you can be asked about the RDA, sources, biochemical functions and deficiency manifestations of vitamin C. So this is the active form. The dehydroascorbate ascorbate is converted to oxalic acid, which is then excreted. So sources are Indian gooseberry, citrus fruits, lemon like lemon, orange, guava. Okay, and they are synthesized in lower animals via uronic acid pathway, and human and higher primates cannot synthesize vitamin C because they lack L-gluconolactone oxidase. Why we cannot synthesize vitamin C? Why we require the sources? Because we lack L-gluconolactone oxidase. Okay, and if the most important is RDA, which is 60 to 75 milligram per day. This is often asked, and this is very important. RDA, which is 60 to 75 milligram per day. And why higher animals cannot synthesize vitamin C? Because they lack L-gluconolactone oxidase. And active form, this L-ascorbic acid. Then this is the metabolism. Dehydroascorbate is converted to oxalic acid, which is then excreted. So now the biochemical functions of vitamin C. Biochemical functions. The most important biochemical function of vitamin C is in the synthesis of collagen. So it does the hydroxylation of proline and lysine in the synthesis of collagen. So proline is converted to hydroxyproline, lysine is converted to hydroxylysine with the help of prolyl hydroxylase, and vitamin C and lysyl hydroxylase and vitamin C. So vitamin C is important for the hydroxylation of proline and lysine, which gives structural strength to the cross-linking of collagen, which gives structural strength to the cross-linking. It gives structural strength in cross-linking in the collagen and stabilizes the collagen structure. Now this is the most important function of vitamin C, which is hydroxylation of proline and lysine to give the structural strength to the cross-linking of collagen and stabilizing the collagen structure. Now the second biochemical function is antioxidant. This is an antioxidant. Okay, this is a free radical scavenger. Then third is prevention of cataract, atherosclerosis and coronary artery diseases. It's prevention of cataract, atherosclerosis and coronary artery diseases. Fourth is oxidation. It helps in oxidation reduction reactions in cellular respiration through cytochrome oxidase. So in oxidation reduction reactions. Fifth is in aromatic amino acid metabolism. Vitamin C is important in aromatic amino acid metabolism. So it is important when tryptophan converts to 5-hydroxytryptophan, and when para-hydroxyphenyl pyruvate is converted to homogentisate. In in aromatic amino acid metabolism, tryptophan is converted to 5-hydroxytryptophan. Sixth is in immunological function. Immunological, so we say that vitamin C is important for immunity. So in immunological functions, then seventh is in iron absorption. Eighth is in conversion of methanohemoglobin to the normal hemoglobin, because methanohemoglobin cannot carry oxygen, so it is important for it to get converted into hemoglobin. Ninth is in bone formation. Then 10th is in steroid hormone synthesis. 11th is in that it spells vitamin A and E in antioxidant function, and it reduces oxidized vitamin E to generate functional vitamin E. So it spares vitamin A and vitamin E in antioxidant function, and it reduces the oxidized vitamin E to again regenerate functional vitamin E. So it spares these two vitamins. So what were the biochemical functions? The first and the most important one was hydroxylation of proline and lysine. Then the next was it works as an antioxidant. It is a free radical scavenger. Then it prevents cataract, atherosclerosis, and coronary artery diseases. It is important in oxidation reduction reactions of cellular respiration, and in aromatic amino acid metabolism, where tryptophan is converted to 5-hydroxytryptophan and para-hydroxyphenyl pyruvate when converted to homogentisate. So if we even remember these five, this is important. What was in aromatic acid when tryptophan is converted to 5-hydroxytryptophan and para-hydroxyphenyl pyruvate converted to homogentisate. Then you can remember this in iron absorption, immunological, bone formation, steroid hormone synthesis, and as well vitamin A and E. Now, what are the deficiency manifestations of vitamin C? Most important one and the common one is scurvy. So, in scurvy, there are swollen and painful gums, bleeding gums, swollen gums, bleeding gums. Okay. And there is hematomas, that is bleeding tendency through fragile vessels. What is it? Hematomas. So hematomas, bleeding tendency through fragile vessels. Through fragile vessels. These are the symptoms of scurvy. And these hematomas, ecchymosis, petechiae, these are the bleeding tendency through fragile vessels. And delayed wound healing, then anemia, and the important symptom is scorbutic rosary, which is the beaded appearance of chest due to prominent costochondral junction. So scorbutic rosary, which is the beaded appearance of chest due to prominent costochondral junction. Scorbutic rosary. Depression of sternum is seen, joint effusion is seen, and Barlow's syndrome, which is infantile scurvy. And due to the defective cross-linking and strengthening of collagen fibers, we have the fragile vessels. Due to what? Defective cross-linking of collagen fibers. Treatment will be high doses of ascorbic acid and diet rich in fruits and vegetables. Treatment is easy. This was all about vitamin C. The deficiency manifestation is scurvy, which is characterized by swollen gums, bleeding gums, hematomas, petechiae, ecchymosis, which is the bleeding tendency of fragile vessels, and delayed wound healing, anemia, and scorbutic rosary treatment. And so this was deficiency manifestation. Then these were the biochemical functions: hydroxylation of proline, antioxidant, then prevents these diseases in oxidation reduction, reactions of cellular respiration in aromatic amino acid metabolism, immunological functions, iron absorption, bone formation, and the RDA is important, 60 to 75 milligram per day. L-ascorbic acid is the active form. This was the metabolism. So now we will read a clinical case on vitamin C. So listen to the clinical case. We'll read two clinical cases. So an 11-year-old child was brought to the hospital with chief complaints of painful bleeding gums and delayed wound healing. Red hemorrhagic spots were noted all over the body. What is the royal diagnosis? Scurvy. Because of bleeding gums and delayed wound healing. Okay. Second clinical case. A 55-year-old lady came to hospital with chief complaints of joint pain and swollen joints. She also had delayed wound healing. She noticed bleeding gum while brushing the teeth. What is the proper diagnosis? It is scurvy. Okay. So as soon as we read bleeding gums or delayed wound healing, okay, or swollen gums, painful joints, okay, or anemia, or this is also an important symptom, scorbutic rosary. So we come to the conclusion that patient is suffering from scurvy.